goals of the health professional are to improve listening acuity to hear accurately. So sometimes in the gym there's a lot of noise going on, or you may be doing something outdoors and ambulances are going by, airplanes going by, so you have to be able to tune into them. Learn to ascertain how accurately a patient has heard you. Sensory overloading, rate at which listener can process information varies. If someone has had a CBA or a traumatic brain injury, and you're talking to them, sometimes it can take them 15 to 20 seconds to process what you just said. So you have to give them time to process it mentally and sensory-wise. Active listening requires undivided attention, and too much sensory input can cause distraction. Steps to more effective listening or selective listening. We've all heard that term, haven't we? Concentrate on central themes. Judge content as opposed to the style of delivery. Listen with an open mind rather than emotionally. Summarize what you heard before speaking again. And clarify before proceeding. So a lot of times you can even do that to your patients. You know, ask them, so what did we just talk about? What's important about getting up from the wheelchair? What's the steps that you want to do? And they can probably summarize it for you. And if you don't, then you can clarify what you just taught them. So goals of the patient interview is to procure information, provide information, give them an understanding of what therapy is, and persuasion to follow the course of therapy. With therapy, you would discuss the goals, if they're in agreement to the goals, what are their goals. So you have an introduction, and it's to help establish the relationship. You're not going to go just right in there and just start digging in and doing things. You want to build a relationship with the person. The body, you want to accomplish work. What work you want to accomplish really is what it should say. And the closing is to confirm the outcome for both parties. And we have verbal versus nonverbal communication. And you can pantomime and demonstrate for people that are non-English speaking patients and you don't speak their language. Some patients have aphasia, meaning that they can't speak. They can understand what you're telling them, but they just can't get it out usually because of their brain was compromised. Hearing impaired, and to supplement verbal instructions. Many patients do good with just a demonstration.